Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, I have Varun Goyal with me, who is the co-founder and CEO for Illuminate Health. Welcome to the show, Varun.
Thanks, Roxy. How you doing?
I'm doing great. So let's get started by telling our listeners and viewers a little bit about your background and what you've been innovating lately.
Sure. So I'm an engineer by background and spent a large amount of my career at Oracle in various consulting roles. Love technology and went to business school for healthcare. Since then, I've been working in healthcare, so medical devices, revenue cycle, and then got passionate about consumer health. And as a lot of these startups and ideas get started is from personal experience, right? So that's what happened with us when my wife and I were pregnant with our first child. We were fortunate enough to avoid a potential miscarriage due to a medication error, and that's what got me, looking into the field and what's on the market. Mm-hmm. So that's really what we're trying to do here at Illuminate. Innovating to make it simple for consumers to really take medications safely in the home environment.
So I'm just curious, medication adherence is a huge financial burden for the country, mm-hmm. and it's also just a really big problem in patient care. And there's a lot of things that have been innovated in the market over the last few years. What is it that, is unique and different about Illuminate and the work that you guys are doing?
Yeah, great question. So there's a lot of great solutions out there. As you said, a lot of people have taken the approach, whether from a device and hardware perspective to software and so on. We basically narrowed down on the pain point of health literacy. In all the literature reviews we did and the patient surveys and everything of that sort, what was highlighted to us was, yes, there's a need to help adherence, but really part of the reason why people are not adhering is because they just don't know when and how to take their medications. Yeah. And, when you're at the hospital, you don't have to worry about medication management because the nurse comes to your bedside at the right time, gives you the right med in the right dose and so on. Whereas at home, you're isolated and you don't have that clinical grade resource guiding you in terms of when is the best time to take the med. There's a lot of technology out there, but is there something that you can really trust to say, oh yeah, I'm using this tool, it's done safety checks for me, it's done the hard work of organizing meds for me, and so all I have to do is follow this, and by the way, if I want, I can be connected to my family members for that support as well. And that's really the path that we're taking, mm-hmm. Relative to what's out there. So it's that clinical intelligence, it's that guidance to instill the trust and confidence in the consumer about taking their meds on their own.
So walk us through what your journey has been like from the time that you had this idea to where you are in the innovation process now, maybe some milestones that you were able to accomplish and some hurdles along the way.
Sure. So we started our initial, kind of research in the 2016 timeframe and incorporated the company in 2017, where towards kind of the second half of the year, we started building the product, after feeling pretty confident about having done all the, studies, literature reviews, and things like that. And then we had our first prototype early 2018 that we started beta testing, and we refined based on that. And we were fortunate enough to have a collaboration partner in Indiana University Health. So we did a formal pilot with them, and actually they helped us think about our product in a more holistic manner because, they were really focused on addiction recovery. And so we actually did a formal pilot with them as part of their intensive outpatient program, and showed some really good patient engagement, and the staff was really excited about the product. So that also was a great milestone for us, because it helped us iterate based on the feedback from patients in a more formal manner as compared to the beta testing we've done on our own. And like I said, it helped us expand kind of our thought process. And thankfully, that pilot made it possible for us to expand to more of their locations. So that's been a great milestone for us. And honestly, at the end of the day, our mission is to help the consumer know when to do something, what to do, and how to do it. We did that for medications, and then now with our work in addiction recovery, we're trying to be a little bit more prescriptive around, well, it's time for you to do your spiritual reading, or you should look up an AA or a smart recovery meeting in your neighborhood to get that social interaction. Or if you're reporting high level of anxiety to us, we can maybe suggest a meditation you can do within the app. So really making it a toolbox of resources for the person at home needing that self-care.
That's incredible, especially with the, the mental health issues that, have been so prevalent for so long, but that are really seem to be increasing significantly, since the pandemic. At least it's come into light more. Yeah.
Absolutely. Yeah. And that's one of the challenges, right? So, we basically have been talking about how the opioid crisis has not gone away.
Right.
And to your point, different types of addiction have only increased over time as people have been in isolation. So yes, definitely happy to be able to mention that on your show as well.
Yeah. I've heard liquor sales has skyrocketed since the pandemic.
Hey, contributing factor for sure.
Yeah.
I am the first one to admit.
We certainly have drank a lot more wine in the last couple of months. That's for sure. So it sounds like, let's kind of dig a little bit into, did you go into this with a specific use case? Because it sounds like you had a whole lot of different target audiences that you could choose from. So I'm wondering if you chose your specific use case before you got to your pilot, or that the pilot engagement kind of helped you determine where you would focus your target market strategy first.
Yeah, great question. So honestly, when we started out with just a simple mindset of what can we build that can be valuable to a consumer, the average Joe, in helping them with managing medications. And then as we started thinking more about, what should be our business strategy and business model, how do we get that adoption? Direct to consumer, of course, is ideal, but that's a tough road for even big companies, let alone startups, especially in the healthcare space. And we definitely wanted that clinical validation, because at the end of the day, we are a clinical, product, if you will, given that, we manage medications at the end of the day. And so that's where we knew we were going to go to the health systems. So having said that, the use case really from a health system perspective, as you know, is to enable better care management with that, monitoring, real-time intervention possibility to be able to prevent the readmission, which may arise from adverse events or medication non-adherence.
Yeah.
So working with IU Health, from a public health crisis perspective, the opioid crisis was kind of on our radar, because at the end of the day, we set out to help people. And so it was really a good parallel, if you will. But on the other hand, as we thought more about it, we had built this broad platform for medication management, where whether you had a chronic condition or two, or now with mental health issues, at the end of the day, the common denominator was medications. And when we looked at the addiction population, 50% of people suffering from substance use disorder are taking at least one chronic med. Majority of them have a history of mental illness for which they might be taking psychotropic drugs. Right. And now MAT therapy is getting more popular, medication-assisted treatments. We found that our medication management engine actually becomes even more valuable. So we have started looking at substance use disorder as one of our first disease-specific plays of kind of this broad, comprehensive platform. So now as we look forward, the mental health component, like you said, is getting more and more common in care models, right? Everyone's talking about integrating primary care with mental health and so on. So I think that's kind of the direction where we become the one spot for a consumer, a patient, a member to manage all of that in one holistic tool.
Sure. So as you thought about, again, kind of not necessarily the user or the use case, but who's going to pay for this, help our viewers and listeners just kind of hear your journey on, looking at maybe hospital systems versus physician practices versus pharma market or specialty pharmacy. What was some of those things that you were analyzing and making that decision on your business model and who you were, expecting to pay for it?
Yeah, and that's a tough one, right? I mean, part of the biggest challenge a healthcare entrepreneur has is, okay, who's my target customer, like you said? Because, on the one hand, the world is open to you in terms of who you want to sell to. So that remains to be a challenge, like for everyone else. On the one hand, you want to be opportunistic, but on the other, I mean, you just can't spread yourself too thin, right? So, so given that we started out on the health system side for the initial validation, we continued to push in that direction. Obviously, with COVID-19, hitting early this year, that slowed down a little bit because health systems, as went into survival mode to some degree.
Hair on fire.
Yeah. So from that perspective, given we were working with the addiction population anyway, we shifted our focus a little bit to more of the independent addiction facilities that were scrambling to, deliver care, but, now virtually. And as well as some of the social service organizations that, are trying to have an impact and maybe just don't have enough resources. So that's where we decided to focus on in the short term, just so we could, keep some of the momentum going from a company perspective, but also, keep the adoption going. Now, as we look forward, some of those health system conversations are starting to pick back up, right? Where we are positioning ourselves, not only as a discharge and a population health management tool, but also as health systems prepare for the second wave potentially of COVID-19 cases. This becomes a great way for their patients to start reporting and tracking on symptoms and getting in touch with a clinician and the health system to have that initial triage. Should I be coming to the ER and risk infection? Should I, so that's how we're now positioning ourselves as, you can get started now, have the initial value, but then have the longer term, value prop, which is always there. But also looking into some of the, more payer aspects of the industry where, health plans, including self-insured employers, are really trying to scramble and figure out, how do we get more health and wellness tools into people's hands. So exploring some of those aspects, but yes, that remains a challenge, like it does with a lot of us.
So, that you might have kind of unknowingly even answered this question, but I'm going to ask, so as an, innovator and the co-founder of the company, what's the most challenging piece of the commercialization process, or, going from an idea to adoption with paying customers?
Yeah, I think there's a couple of different challenges. I think one is definitely the focus, like we've discussed. I think the bigger challenge to some degree, given the healthcare industry that we have in this country, full of regulation and entrenched interests and so on, it's just hard to get your foot in the door in a lot of cases to have someone take that chance on you, if you will. And so what ends up being a chicken or the egg type situation is you might go talk to a big company and they love what you are doing, but then they want to see results first. Have you done outcome studies? Have you done this? And that's tough for startups to do, because that's costly. You go to an average academic health system, you might need a budget of a couple of $100,000 to do an outcome study, which may or may not work out. So I think those are some of the initial, challenges where, everyone tries to, utilize kind of friends, family, networks, right, to try and get conversations going, and really find those early partners.
Mm-hmm. Yeah. I always, recommend that clients, think about, tying sales to the back end of those pilot agreements. Because, even if you've got the data, that, like you said, there's a lot of time, there's a lot of money that's going into it. So, doing some type of shared expense model, so that way the entrepreneur is not having to carry the entire burden, right? And then also that tied to, hey, if X, Y, and Z happens, can I get your commitment up front that you're going to roll this out in X way? Sometimes we get so excited about, whatever hospital system said yes to a pilot that I say, like, we kind of get a little woo-woo. It's like, oh my gosh, game changer. And it can be actually a death trap.
Yeah.
Right. And so if we don't do it right, with those strategies and tactics up front, with something that looked like a really good thing can actually turn into something that can be a challenge. Or
that's exactly right, because things happen. Leadership changes can happen in that time frame, or the market can change. COVID can happen, right? I mean,
a global pandemic can happen.
I mean, what are the odds of that? I mean, and what is that? Death by 1,000 pilots, to you name it, right?
I call it pilot purgatory. When they get stuck in the pilot, and I've heard it just even in metropolitan areas where you might get a pilot with one big hospital system, and you're like, yes, this is it. And then you go to the next hospital system, like 5 miles down the street, and they're like, yeah, but we need to do a pilot. And you're like, oh, well, I'm so glad you asked, because we did one 5 miles down the way, and here's the data. And they're like, yeah, but our patient population is different. And you're like, oh my gosh.
Becomes a vicious cycle where, okay, where do you get off?
Right. Yeah. Oh my goodness. What a crazy ride, right?
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed, without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
So what has been the biggest win for you since you got started, where you kind of look back in retrospective and you're like, wow, this was a game-changing decision. Maybe I didn't see it at the moment, but when I look back, this really was a game changer for us.
I think so. A broad answer, maybe, from a personal perspective, always was innovation minded and entrepreneurial. Having worked at big companies, always took the approach of being an intrapreneur as compared to an entrepreneur. So have just thoroughly enjoyed the opportunity to be an entrepreneur and work on something like this. I think what's been really fulfilling has been to actually hear from some of the patients who've utilized our product and see that, they derive value from it, they benefited from it, and it made their life easier, whether it's 10% easier, took one thing off their to-do list for the day, right? Whatever it might be, to being able to kind of coach and mentor a lot more people along the way, whether, folks who kind of worked with us or we just came in contact with. So I think those are some of the things that have been really fulfilling.
Yeah,
overall.
that's great. I could have used your solution the last couple of weeks. So I'm a caretaker for my 91-year-old grandmother, and she's just started experiencing some pain in the last week, called the doctor. We did a video visit. My grandmother's pretty excited about that, and
Yeah.
she really likes it, actually.
Okay.
And we got a prescription for her, and she was so sick and so nauseous, and so she'd stopped taking the medication, and she'd rather experience the excruciating pain than be nauseous and be sick from it. And come to find out today, and I kind of feel like I was neglecting her, that I didn't even know this, but she was supposed to take it with food or eat before she took it. And so, the doctor never said that, or if he did, I didn't hear it. And I didn't read it on the little tiny, information that comes with it when I picked up her script. And so, she was had to take a Priselect, so I knew it could upset the stomach, but she was already taking another prescription medicine with it to make sure that this didn't happen. So anyway, I could have totally used your tool or still can use your tool to help me navigate this season with her.
Yeah, and I can completely, understand that scenario, and I appreciate you bringing that up, because that's exactly, why we've done what we've done and the approach we've taken. Because, even if it's, folks who are, let's say, educated, and like you said, they're reading the leaflets, but still, I mean, there's a lot to process, and there needs to be a simpler way to just have that be done for you.
Yeah.
I kid you not, I was on a flight coming back from San Francisco. Maybe this was the last one I took this year. And the flight attendant, just was really friendly, and we started talking, and she basically said she'd been taking a thyroid medication for 10 years and no results coming off of it. And for whatever reason, no one told her actually it needed to be taken on an empty stomach first thing in the morning.
Uh-huh.
And I'm just like, you know what? That's why we're doing what we're doing.
Yeah, those little things, but there might be a tiny piece of information, but can be very valuable, game changer in care.
Yeah, I mean, my personal favorite has been, ciprofloxacin, right? It's a standard antibiotic that, you take for bronchial infections or whatever else. I was prescribed that at some point while researching this product, and I did sit and read through the leaflet.
Yeah.
As soon as I got past the suicidal thoughts and death, I saw that, the drug molecule from Cipro binds to calcium in food, and hence this should be taken a minimum of 2 hours before or after a meal. And I'm like, why would no one tell me that? I've been taking this, for 5 days already. So, but in any case, it's things like that make the difference.
Yeah, completely. So let's talk about this global pandemic, how, it's really impacted companies in different ways. Mm-hmm. Some of them have kind of assessed the changing market conditions, and it's either created incredible opportunity or it's been a huge roadblock in different aspects of the business. And sometimes it's a combination of the two. It's challenges, in sales. Now we move to virtual sales. Oh my gosh, now we need to adapt our sales strategy. And it could be, doors closed for our, target market for a season, or maybe for a much longer, and we need to look at another target market segment to pursue. So kind of just walk us through what that's been like for you.
Yeah, you bet. So it's definitely been, a bump in the road to kind of have this global pandemic, land up here. So we feel like we had a lot of good momentum leading up to kind of, early March, which definitely slowed down tremendously.
Yeah.
So that was definitely challenging. And of course, just like a lot of other, startups, we looked into a lot of the government funding mechanisms and so on to stay afloat. But at the same time, what we did notice was that the existing utilization of our product, went up, because, you think about the patients that we have on the substance use disorder side, most of them being really motivated and not letting the pandemic kind of, drive them down, actually were maximizing all the tools available to them to stay on track with recovery. So, even though I kind of mentally, emotionally was a little bit low, in the early days. But when I saw that take place, I mean, that was motivational. That was inspiring. And then we started, as the new reimbursement codes for telehealth became available, especially for the virtual check-in, the e-visit, we decided to try and kind of align ourselves with that to some degree, even though, we had never thought of ourselves as kind of a traditional telehealth product, right? Because we don't do video consults.
Right.
We do offer text messaging as a communication mechanism, along with real-time alerts and notifications. But it made us kind of think about it in maybe a more accelerated manner than originally we were thinking, we would do. So I think that's kind of some of the learning and, what we did to kind of adapt to the new landscape. So now, like I said, thankfully, some of the conversations initially are picking back up along with some of the newer market segments. I think hospitals are definitely planning on, what their overall telehealth strategy needs to be, because, it's here to stay, right?
Right.
What people are trying to figure out is, so now telehealth adoption went up, but then was it the adoption in terms of just getting access to someone right away? Now that things are opening back up and your own provider maybe has become telehealth capable, will you actually go back to your own provider? And so then this, new growth that took place is actually going to, kind of subside over time. So these are some of the things people are trying to figure out, along with the privacy and other aspects. But yeah, I mean, that's kind of how we're thinking about it.
I think that the physicians, what I'm hearing and seeing, even firsthand, with my grandmother's experience, is the ones that weren't necessarily telehealth practices before that have adapted to that just because of the COVID crisis, whether they like it because they're getting compensated financially for it now or not. Still having this hybrid model seems to be a challenge, where if they were all virtual or whether they were all physical, that it would be a little bit easier for them than trying to navigate the waters of both at the same time. The doctor that I was seeing was, 45 minutes late. And to me, that's unacceptable in a virtual environment, whereas that would be really normal in a regular face-to-face office visit. But so he's juggling someone that has a video visit, but a face-to-face patient before us that, you're not going to just go, hey, we got to wrap it up, right? You do your patient care. So I think it's just, I agree with you. I think that it's here to stay. And I think that, over the next few months, the next year or so, we will start to figure out what those hybrid models look like and how tools like yours fits in and kind of helps with that model of care.
Absolutely. I mean, our value prop, honestly, is the care continuum.
Yep.
So, primary care, the specialists you see, and so on, at the end of the day, having all your information in one place and having the tool guide you along your journey, as compared to this transactional or episodic model to some degree. But yeah, I mean, I think, to your point, I had a telehealth consult. It was great. I was not having to commute to the doctor's office. I did not have to wait in a waiting room where I potentially might be getting infected with something else. And, it took maybe 10 minutes of my time. And so the convenience factor, it's definitely there, And in my case, it was my own provider. So that was the other, good thing. But anyway,
yeah, that makes sense. So I wonder, so there's so many different changes. I think that, health innovators can be examining during the changes in the market conditions. Has anything changed from your perspective, from a partnership and alliance opportunities that might be a shift or a game changer for you in your commercialization strategy going forward? Is that something that you've thought about yet or not yet?
So I think, so definitely potential partnership conversations are always ongoing. So for us, the partners could be, pop health or disease management vendors who have kind of, A and B module, and we can provide the rest of the solution, to really getting to some of those providers where we can be the technology platform to enable the care management.
Yeah.
So, I mean, we're continuing along the same conversations. I wouldn't say that, the new landscape has changed anything too much, except to say that maybe the need, like we were talking from a telehealth perspective, has just, gotten accelerated, and people have just had to scramble and adapt. So something that was gonna take maybe a decade now is here already in a period of, 3 months. So I think that's going to be good, because for us, on the medication management side, now, we can accelerate the virtual medication therapy management services side of things, and so on. So I think those are some of the conversations that have maybe sped up a little bit.
Yeah. I'm just curious. One of the things that comes to mind is, the hospital systems, their hair's on fire, if their attention is on things like telehealth, is it viable, for you as well as maybe other listeners and viewers to partner with those telehealth companies to be an add-on solution, and using that as like a distribution channel for your solution, especially in the interim where the hospital systems might not be paying as much attention for new opportunities where they might be able to get in the door while you or other health innovators can't?
Yeah, great question. Definitely something we've been thinking about, and exploring. So I think there's maybe two different ways of approaching this. So one is to go to a telehealth vendor, whether it's an American Well, MD Live, and others, to, like you said, right, integrate with them and then kind of go to market.
Yeah.
I think there's value there, especially in the ones that have more of a primary care, aspect of it, because, for the most part, if you're doing a transactional video consult, to replace an urgent care visit, are you really looking at, getting a tool for managing meds and things like that? Potentially, I don't want to say there isn't a need there, but I think, and then you look at the other side where health systems, like we were talking, are adding those capabilities themselves to offer video consult services. So I think as part of a broad virtual care telehealth strategy with a health system, there's definite alignment where, with a vendor that does video consults, they're kind of part of the portfolio, and then we cover the patient self-care and other communication aspects of it. So those are some of the ways we're kind of segmenting that thought process as we move forward.
Okay, excellent. So what are the biggest opportunities for you in the future? What's on the horizon for Illuminate Health?
It's going to be an exciting year, one way or the other. It already has been, right? So we're looking forward to our new advisors that have just come on board. So really just honored and thankful to have such a great team to help be the wind beneath our wings, and to actually believe in us and want to be a part of our journey. So that's really exciting. I think the other aspect is to start doing planning for a potential fundraise. So it's going to be our first kind of a seed round, if you will.
Yeah.
Apart from just more traction and more impact on patients.
Yeah, that's great. So the advisors, again, kind of taking in consideration our listeners, what's important, what to look for in an advisor, maybe something that we might not be on our radar already.
Sure.
Yeah.
Yeah, I mean, I think at the end of the day, you want to, look for people that believe in what you're doing and actually are passionate about the same space, if you will. And then, you have to take a look at existing capabilities on the team,
Yeah.
And then see how you can augment what's already part of the team. And so, we took that same approach, and essentially we're talking to a lot of different people, and decided that the fit was correct. With 3 people we just brought on board, and now have a couple more of those conversations going, because we still have room to grow. So I would say those would be some of the ways to think about this.
Yeah, I mean, I think that the advisors, that you work with play such a critical role. I call it like a thinking partner. They're external to the company. They see things that you don't see. So besides the networking, the introductions that are usually really can be game changers for the commercialization strategy, but also, being able to be that thinking partner, because for an entrepreneur, in a lot of ways, even when you have a team, it can be a very lonely endeavor, right? And as a startup, you've got a limited amount of resources, and you most of us can't afford and don't want to afford to make the wrong decisions along the way. I mean, of course, nothing's going to be perfect. We'll always adapt, but really being able to have that thinking partner to wrestle with those ideas, to kind of figure out what's going to be the most viable and profitable path, I think is just so important.
That's exactly right. Yes. Yeah. And I mean, at the end of the day, you're going to work with people you enjoy working with. Because with one of the advisors recently, I must have sounded not as myself, and so he literally said, "It's all right, we'll get there."
Yeah, because it's
right?
it's an arduous journey, and so some days you need advice and wisdom, and some days you just need some encouragement, inspiration, right?
Yep, that's exactly right.
Yeah. So, thank you so much for your time today. Before we wrap up, what are some lessons learned or some words of wisdom that you would want to share, advice that you want to share with our listeners and viewers?
So I would say for anyone who's exploring entrepreneurship, definitely don't let any of this scare you away. It's a worthy career path. It's definitely a way you can have really high level of impact and learn a lot, honestly. So definitely happy to obviously talk to anyone who's exploring that. So feel free to reach out. I think apart from that, some of the learnings that we've had along the course of the way are what I've been reading about recently as well, which is you want to find the right team to start with. And look for the complementary capabilities in your core team. And of course we already talked about the advisor side, but then also keep enough of a focus from a market perspective as you're heads down building your product as well, because not only is it crucial to have user input into let's say a screen that you're designing, but it's also really crucial to have that business aspect always out there. So I would say those would be some of the kind of pieces of advice as people think through this.
Awesome. So how can people get a hold of you, Varun, if they do want to follow up with you after the show?
Yeah, obviously, LinkedIn and, following your show. My email address is vg@illuminate.health. So happy to, be reached there. Our website obviously is illuminate.health. So yeah, feel free to check us out. And thank you for having me on the show.
Yeah, thank you for being a guest today.
You bet.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app, like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.